Breaking news for Social Security and SSDI recipients across America. Congress has just approved a groundbreaking $5,800 lifetime support fund, scheduled to begin disbursement on March 1, 2025. This revolutionary program is initially rolling out in 25 states, and today I'm going to reveal everything you need to know about qualifying and claiming your share of this life-changing support, which could provide up to $483 monthly in additional assistance. The financial landscape for Social Security beneficiaries has been particularly challenging throughout 2024, with persistent inflation rates affecting fixed incomes and essential costs continuing to climb. Millions of Americans have been struggling to make ends meet. However, this new support fund represents a significant turning point, offering not just temporary relief, but a lifetime benefit that could fundamentally transform financial security for eligible recipients. Let's dive deep into what this $5,800 lifetime support fund really means for Social Security and SSDI recipients. This initiative, approved with bipartisan support in the latest congressional session, represents one of the most significant expansions of support for beneficiaries in the last decade. Unlike previous assistance measures such as pandemic-era stimulus checks, this program is designed as a sustainable, long-term solution. Recipients will have the flexibility to receive their support in monthly installments of up to $483, quarterly distributions of $1,450, or customize their disbursement schedule based on their specific needs and financial planning goals. The $5,800 allocation wasn't determined arbitrarily. It's based on comprehensive research conducted throughout 2024 that analyzed the additional expenses typically faced by Social Security and SSDI recipients beyond their regular benefits. This includes considerations for healthcare costs, which have risen by an average of 6.8% in the past year, housing expenses that have increased by 4.2%, and essential daily needs that continue to stretch fixed incomes to their limits. The initial 25-state rollout strategy, beginning March 1, 2025, includes states with the highest concentration of eligible recipients: Florida, Texas, California, New York, Pennsylvania, Ohio, Illinois, Michigan, North Carolina, Georgia, Arizona, New Jersey, Virginia, Washington, Massachusetts, Tennessee, Indiana, Missouri, Wisconsin, Maryland, Minnesota, Colorado, Alabama, South Carolina, and Louisiana. This phased approach ensures proper administration and smooth distribution of funds, with nationwide expansion planned for early 2026. The application portal opens on January 15, 2025, giving potential recipients 6 weeks to submit their applications before the first disbursement date. Early applications submitted between January 15 and February 1 will receive priority processing for the March 1 pay cycle, while later applications will be processed for subsequent monthly distribution dates. Eligibility requirements have been carefully structured to ensure support reaches those who need it most. Primary qualification begins with current enrollment in either Social Security Retirement Benefits or SSDI as of December 31, 2024. Income thresholds vary based on household size: $32,000 for single recipients, $48,000 for couples, and additional allowances of $8,000 per dependent. For Social Security retirement beneficiaries, the program considers current benefit amounts and additional income sources, including investment income, pension payments, and part-time work earnings. SSDI recipients face slightly different criteria, with the program taking into account factors such as disability severity, current benefit amount, and additional household income. Recognizing that disability-related expenses often create additional financial burdens, SSDI recipients with documented medical expenses exceeding 15% of their annual income may qualify for supplemental support of up to $750 per quarter. The program offers considerable flexibility in fund usage while ensuring responsible utilization. Approved expenses include medical costs not covered by Medicare or other insurance, housing-related expenses such as repairs and modifications, utility bills, and essential daily living expenses. Starting in April 2025, the program will introduce a special allocation for preventive healthcare services, allowing up to $12 annually for wellness visits, preventive screenings, and dental care not covered by traditional Medicare. The application process has been streamlined for accessibility while maintaining necessary oversight. Recipients must submit documentation proving their current benefit status, income levels, and residence in one of the participating 25 states. This can be done through the Social Security Administration's online portal or through local Social Security offices. Designated support centers in each participating state will provide application assistance. A robust emergency access provision allows recipients to request expedited fund release in critical situations, with processing times of 48-72 hours compared to the standard 2-3 weeks. This feature will be particularly valuable for unexpected medical expenses or essential home repairs that might otherwise create significant financial hardship. For states not included in the initial rollout, the expansion timeline has been carefully planned. The second phase of implementation is scheduled for January 2026, adding another 15 states, with the remaining states being incorporated by July 2026, achieving nationwide coverage within 18 months of the initial launch. The program includes innovative features for fund management and long-term planning. Recipients will have access to a dedicated online portal for tracking fund usage, planning future expenses, and accessing financial planning resources. A mobile app launching in June 2025 will make it even easier for beneficiaries to manage their support fund and submit expense documentation. An important aspect of the program is its cost of living adjustments, COLA provision. The initial $5,800 allocation will be reviewed annually, with the first adjustment scheduled for January 2026. These adjustments will be based on the Consumer Price Index for the elderly, CPIE, ensuring that the support remains meaningful as living costs change over time. The program has established partnerships with major healthcare providers and pharmacy chains to offer additional discounts to fund recipients. Starting in May 2025, participants will receive a program card providing additional savings of 10-15% on prescription medications not covered by Medicare and 5-20% discounts on eligible medical supplies and over-the-counter medications. For multi-generational households, the program offers special considerations. Families where both elderly parents and disabled adult children receive benefits may qualify for enhanced support, with potential combined household benefits of up to $8,700 annually. These enhanced benefits will become available in September 2025, following a program review and adjustment period. The financial counseling component launches in April 2025, offering recipients access to certified financial advisors who can help develop personalized plans for fund utilization. These services will be provided at no additional cost and will include quarterly review sessions to help recipients maximize their support fund benefits. Looking toward future developments, the program includes provisions for potential expansion of covered expenses. A review panel will meet quarterly to evaluate additional needs and may approve new categories of eligible expenses based on recipient feedback and changing economic conditions. The first such review is scheduled for June 2025, with approved changes implemented by October 2025. For recipients concerned about tax implications, the program has been structured with tax efficiency in mind. Support fund distributions will be classified as non-taxable benefits at the federal level, similar to certain Medicare advantages. While state-level tax treatment may vary, program administrators are working with state authorities to secure favorable tax treatment across all participating jurisdictions. The program includes a unique feature for seniors who wish to age in place. Starting in August 2025, recipients can allocate up to 30% of their annual fund toward home modifications that improve safety and accessibility, including installations of grab bars, wheelchair ramps, and other essential mobility modifications. Now that you understand what this $5,800 lifetime support fund offers and the important dates to remember, it's crucial to take action if you think you might be eligible. Don't miss the January 15, 2025 application opening date. Mark your calendar now and click the link in the description below to access our comprehensive guide on qualifying and applying for these funds. Be sure to subscribe to our channel and hit the notification bell to stay updated on any changes or expansions to this program. We'll be providing weekly updates on application procedures and program developments leading up to the launch date. If you found this information helpful, give this video a thumbs up and share it with anyone you know who might benefit from this support fund. Remember, knowledge is power, and sharing this information could help someone access the financial support they need. This program is designed to provide real lasting support for those who need it most. With the first payment starting March 1, 2025, now is the time to prepare your documentation and understand your eligibility. Don't wait to find out if you qualify. Take the first step today by checking your eligibility and gathering the necessary documents. Thank you for watching, and I'll see you in the next video with more important updates on Social Security and SSDI benefits.